As healthcare professionals prepare to take care of patients with COVID-19, many are concerned about the shortage of vital supplies needed to provide care during the epidemic, like ventilators.
We are doing everything we can to orient our efforts around the world to get more ventilators in the state.
In this video, we take a look at why ventilators are important in providing care and what is being done to prevent a shortage.
So a ventilator is a breathing machine. It pushes air into and out of your lungs. It is the treatment for people who develop failure of their respiratory system.
I like to describe going on the ventilator as a way to buy the body time. It doesn't cure the virus. It helps the lungs get air in by forcing that air in, as well as delivering high levels of oxygen to allow the patient to rest and heal.
What we have seen in China and in Italy, the people who are at risk of developing severe disease or infection are typically those who are older than 60 years old, or those who have other chronic medical conditions.
Is there also a risk for younger people needing a ventilator as well?
Yes, so we're starting to see this in the United States, and it's a bit different from what we have seen in China and Italy. We have seen patients less than 50 who are now on mechanical ventilators, and this was not really commonly reported from Wuhan as well as from northern Italy. So it looks like the demographics has changed a little bit, and all the lessons learned from China and from Italy may not necessarily be true for the United States.
How long are you seeing people requiring ventilators to get through COVID-19?
Looking at the limited literature that's out there, typically patients who do end up in the intensive care unit end up staying in the intensive care unit for 3 to 6 weeks. So these are pretty prolonged stays in the intensive care unit. That doesn't mean that you're on the ventilator that entire time, but you can expect a very prolonged period of critical illness with this infection if you do get severely sick.
To prevent a shortage of ventilators, a number of companies have stepped in to fill the gap.
As I mentioned yesterday, the heroic work of Elon Musk, who came through on his promise to deliver over 1,000 ventilators.
In addition to buying ventilators from China, Elon Musk claims that Tesla and SpaceX can produce new ventilators with their factories. But these are complicated machines. Medtronic, a company that manufactures ventilators, uses over 1,500 parts to make one machine, and they say it will take months to increase output from their factories that are already making them. Medtronic also said, "We believe the fastest way to get additional ventilators into hospitals is for us to leverage and grow our existing infrastructure." Bloom Energy, a company based in San Jose, California, is attempting to help in a different way by refurbishing a stockpile of old ventilators. This is footage of their team at work. Another challenge that hospitals will face is having the staff to operate these additional ventilators.
Really, at the very minimum, 3 healthcare providers are responsible for managing the ventilator. Even though it is so capable of doing a lot on its own, it still does require a good amount of personnel to manage just one patient.
So it's not just a matter of ramping up the number of ventilators. It is not straightforward. It's not a matter of just hooking up the patient and then delivering that breath every time. The care of someone on a ventilator is complicated.
You know, we're fortunate right now that we have a huge staff and a huge redundancy in our system as it stands. But at a certain point, both with the number of patients that grow as well as potential healthcare worker exposures, we could easily see our staff, numbers decline. And so I think that's definitely a concern everyone is sharing, but we're doing our best to prepare and be ready for a surge event. If we're taking any lessons from what's happening in Italy and now what's been happening in New York just over the last week, I think we're all concerned and we're all planning and preparing for not if, but when the surge of COVID-19 patients hits our front door.